Welcome to Healthcare Musings, a podcast dedicated to the discussion of critical care, the medical field, and healthcare in general. Here is your host, Dr. Hassaballa. Hello, everyone. This is Dr. Hassaballa in another episode of the Healthcare Musings podcast. Happy to have you with us. Okay, so major change in the CDC, where they have updated their isolation guidance for COVID-19. And I think it's important just to comment on it. First of all, one of the major changes is that there's no explicit mention of COVID, that it's just a respiratory virus. And so it's finally bringing COVID in line with other respiratory viruses, such as RSV and influenza. That's huge. Having been on the front lines, having seen what devastation that the original COVID virus brought on people, this is a major change. And what's different is that the 5-day isolation guidance is now gone. And what they say, and I'll link the CDC's website in the show notes, is that, if you're sick, stay home and away from others, right? And that's common sense. And that's something that we should have done all along, right? It makes sense. If you're sick, stay home, rest, relax. You need to get enough sleep. You need to hydrate. You need to allow your body to fight off the infection as best as possible. Because with influenza, there is oseltamivir, or the brand name is Tamiflu, that may help you feel better more quickly. There's Paxlovid, which is the antiviral for COVID that does help people feel better. If you get COVID-19, there is yet not an antiviral pill that you can take for RSV. And so if that's right for you, after speaking with your doctor, you can take Paxlovid or oseltamivir. I've definitely taken oseltamivir or Tamiflu when I got the flu, and it made me feel better. But the 5-day isolation guidance is now gone, right? And you can go back to normal activities if you're fever-free for 24 hours and you're getting better, right? That's major change. And I think this is really good for healthcare workers because, sometimes healthcare institutions are so barely staffed. Like the loss of one or two staff members can cause a major difficulty in staffing ICUs and nursing floors and other medical floors, because we just can't afford to have healthcare workers be out for that long. And so this is huge, and this is common sense. It really makes common sense. And again, they say when you go back to your normal activities, take added precautions like open the air windows if you can, increase ventilation, wear a mask. If you're around vulnerable people like elderly parents or grandparents, immunocompromised friends or family, people who are on chemotherapy or taking drugs that suppress the immune system for whatever reason, because COVID in those people can be serious still, right? There are still people that are dying from COVID, although it's not like before. In our hospital, we have a lot of patients. Not a lot. Let me rephrase that. There are a steady stream of COVID patients, and it's not like before. Recently, I had a patient who looked like the severe COVID ARDS that we used to see in the past, and it turned out that she was COVID positive, but it turned out that her infiltrates were from severe heart failure and not COVID-19. So a lot of times, what I've been seeing in my practice is that the patients with COVID that come in with COVID are coming in for something else. And oh, by the way, I have COVID, right? So I think it's about time, really, that the CDC, and I know some clinicians are decrying this, oh my God, what if there are vulnerable people still out there? There's no question about that. There are vulnerable people still out there. And they have to be careful, and you should be careful around them. So if you're going to be around a lot of people and you're just still getting better, but you're not back to normal, maybe you should wear a mask. That's just common courtesy, right? And that's just etiquette. So you don't want to get other people sick. It's just like sneezing into your arm or coughing into your arm. Um, so I think we need to just have more virus etiquette, for lack of a better word, um, and that's really important. Uh, and then so the CDC guidance goes through, kind of steps you can take as an individual, organizations, so on and so forth. But I think this change finally reflects the fact that this COVID virus, okay, the current variant, is not like the original COVID virus, right? It's different. The disease has evolved to become, I think, more contagious, but much less virulent for the vast majority of people. Now it's become like a bad cold, whereas before, in the original stages of the pandemic, and then with the Delta wave and then the Omicron wave, COVID was still causing life-threatening respiratory failure and organ failure. It is largely not doing that, again, for the vast majority of people. Okay, it can still be a deadly illness for certain subgroups of patients, very elderly patients, immunocompromised patients. There's no question. Just like influenza can be very deadly in the right patient population. In fact, I had a patient that came in with swine flu, H1N1 influenza. He didn't take the vaccine, the flu vaccine this year, which includes swine flu in it, right? And he was kicking himself because he was admitted to my ICU and he just was miserable. Thank God he wasn't super sick, but he was miserable and he was very regretful that he didn't take the flu vaccine. So, I mean, these respiratory viruses in some patients can be very deadly, just not we're seeing it's not in the majority of patients. That's what I've been seeing in my practice. It's just not like before. It's a different illness, and finally the guidance is changing as the disease is changing and evolving. And I'm very grateful that it is much less virulent than it was before. This is a mercy, really. It really is, because this thing, and I saw it firsthand, it killed a lot of people, more than 1 million people. Man, that's a big deal. Okay, it killed a lot of people, but that was different, right? I got COVID in the original form. I've never had a viral illness like that, and I've had flu multiple times. I've never had anything like that, right? So it's different now. It's different. I suspect over the holiday, I got COVID. It was just a bad cold. I never tested, but I strongly suspect it was COVID. I was fine. It was just an annoying cold, not much else. I can't prove that because I didn't test myself, but still, the point is, I'm so happy that the guidance is changing because the disease is simply not the same as it used to be. Anyway, thanks so much for your time and attention. Until next time, this is Dr. Hassaballa signing off on the Healthcare Musings podcast. Take care, everyone.